This is a quick tutorial on the Mediana AED A15 model. As you can see there, it comes with a few accessories. One is the carry case. Comes with a handle there so you can carry it or you can hang it on a coat hook, etc. This is the battery, which doubles up as the handle. It's a little bit fiddly to put on and take off, but obviously it stays on the whole time. It's just not on yet because the unit is new, and I want to show you how to put it on. It comes with a prep kit, more on this later, but it contains things like scissors, razors and gloves and things along those lines. And as standard, it comes with a 5-year manufacturer's warranty, so you just register it on the website, the Mediana website shown there. And it comes with a manual. This should be read obviously in advance of the day of using it, not on the day. And then I'll connect the battery in a minute. I'll just show you how the main unit works. So here you have the little tab from the pads. So it's got the date, is normally backwards, so this one says the 5th of October 2023. To switch it on, there's a little slider there, and then there's indicators here. At the minute, because there's no battery installed, you'll be able to see there's a red cross on there. Once the battery is installed, it will show a blue circle, and that means it's done its daily diagnostic and all is well. And this indicator here, obviously, because there's no battery on, is blank. When you put the battery on, it has little segments on it to show you the strength of the battery, and the battery lasts approximately 5 years if the defib is kept in a reasonably warm environment. So if you ever see one in a cabinet, that's why it's got an electricity feed to it. There's a little heating plate in there, and it stops the defib from getting too cold. The defib itself doesn't need any external power supply. It is a sort of fully contained unit. So to switch it on, you would open the lid by sliding that to open, and then it would now be speaking to you. Obviously, if it's speaking, you won't be able to hear me, so I've not connected the battery yet. The standard, you would have it on adult setting, but the beauty of this defib is if you've got someone who's 0 to 7 years old approximately, or under 25 kilograms, so halfway through year 3 in school, if they're under that age, you would early on slide it to pediatric, and then later when it gives a shock, if it needs to, it would do a reduced shock level. As standard, you want to have that set to adult mode. So the beauty of this defib is it speaks to you and it talks you through each picture. So the first picture, as you can see, shows you putting the pads on. So they're colour coded, but it wouldn't matter if you put the green pad around the side and the red pad on top. It's just an easy way of showing you one pad goes there and one pad goes there. There's a little video to follow, so you'll see how all that works. We've zoomed in here just to show you a close-up. Once the pads are on, the unit detects automatically that the patient is ready for assessment, so it'll start on the assessment and it's telling you not to touch the patient there, and that's the picture of a person not touching them. If the unit decides they need a shock, and bear in mind not all patients need a shock, it will tell you to press the shock button, which is this one here. This will flash bright red. And then afterwards, as a standard thing, people get 2 minutes of CPR. Now this unit tells you to do compressions and breaths, but as you'll know from training courses, you may not always be in a position to do the breaths, so it is acceptable just to do the compression. Just ignore the bit when it tells you to do the breaths, if that's the case. So the pads are pre-connected, and every 2 years approximately, you should replace the pads, so it's up to you to keep a check on that. And as they're pre-connected, to remove them, you just press down on there and pull it out, and to get the new ones in, you just plug it in there, pretty straightforward. You clip them in these little plastic holders, and then the pads there, you've got a little tiny little cut in them, and you just tear that little perforation, and then it's like a sachet, so the pads will come out. It's also got a picture of where to put the pads on the outside here, so on an adult diagonally there, and on a child one at the front and one at the back. And on each pad itself, it'll have a picture of an adult and a child, so you know where to put the pads. After you finish the unit, you would remove the pads and replace them if you've got a spare set. And all you do, basically, is just close the unit up like that, and then it would just switch off after a few seconds. If you wish to, you can put a SD card in here, and that can be given to emergency services. And also, if the ambulance has the technology, they can infrared the information across like that. So the battery goes on there, Obviously there's one end with a connector, the other end is just where the battery hooks in, and this here is the lever. To press that you can remove the battery. Pretty straightforward stuff. And then it's got details of the serial number, etc. on the back there. So to apply the battery is a little bit fiddly, but essentially it hooks on. So the red's at the front like that. It hooks in there and get it just right, just to the right angle, and then it'll just clip in on the other side like so.
Unit OK.
Once the battery is on, it stays connected. And as you can see here, the blue circle means all is well, and the battery power is full because it's a brand new battery. So I'll just put the unit on just so you see what happens in that first few seconds, but essentially I'll stop speaking so you can hear it.
Unit OK. Adult pads. Remove clothes from the patient's chest. Place pad exactly as shown in the picture. Press pads firmly to patient's bare chest. Remove clothes from the patient's chest. Place pad exactly as shown in the picture. Press pads firmly to patient's bare chest.
Slide the green toggle to the right to select pediatric mode.
Remove clothes from pediatric pads. Remove clothes from the patient's chest. Place pad exactly as shown in the picture. Press pads firmly to patient's bare chest. Remove clothes from the patient's chest. Adult pads. Remove clothes from the patient's chest. Place pad exactly as shown in the picture. Press pads firmly to patient's bare chest.
So this is the AED prep kit. You get these with your defibrillator. There are a few things to go through very quickly. So a pair of gloves there. There is a pair of medical shears. So you would cut the person's clothes off if needs be, the bra if needs be. Try and start off at the chin end of the body and work your way down to the belly button. So if you slip, you are going to stab them in the throat. But the scissors themselves have a rounded edge, so hopefully you won't be causing any damage. As you can see they're a bit different to normal standard scissors. They're medical shears, so they've got a rounded end and very sharp, very good for the job. What you've also got here is a razor. You'd use the scissors and the razor together. You would snip any long hairs with the scissors, and then you would use the razor to cut any shorter hairs. Seems a bit of a strange thing to be doing, but the pads on the defib won't stick unless the chest is accessible. So if they've got lots of bushy hairs on the chest, you need to snip them first and then just do a shave with a razor. You've also got some cleansing wipes there to give the person's chest a quick wipe down if needs be, to get rid of any excess hairs, for example, or if there's any mud or any dirt on the skin. There is basically a few paper towels, and also, as you can see here, you have the rhesus mask. You'd put that over the nose and the mouth, and you'd be able to give them rescue breaths if you were going to do that part of it. And also at the very end you can stick it all in a bio waste bag to dispose of. If the patient is not breathing, send for an ambulance, tell them they're not breathing, start CPR, and make sure you send for the defibrillator. When the defibrillator arrives, open the lid to switch it on and follow the instructions to apply the pads. Remember, you may need to cut clothes off, you might have to shave the chest, or you may have to switch it to pediatric mode. Once the pads are applied, the unit will assess the patient automatically. If unit decides the patient needs a shock, the red button will flash. Ensure everyone is clear, press the red button, then immediately start CPR. Every 2 minutes you will be instructed to stop while a further analysis is done. More shocks may be needed. Unless you are told to stop or the casualty recovers, continue CPR. Watch this demo video. Note, I am using a generic training unit, so button position, etc. may be different from the real unit. Demonstration of a defibrillator with an adult. You're doing the compressions and possibly the breaths. The defibrillator arrives. As soon as it arrives, switch the defibrillator on. It'll speak to you.
Applying pads to patient's bare chest.
So the pads have a picture
Pads connector next to flashing light.
on the bare skin. Put one pad into position. Put the second pad
Applying pads. Plug-in connector.
into position. Most defibrillators, this will already be connected. For the training unit, you connect it and that takes it to the next stage. So I'll just plug that in and that'll take it to the next part.
Analyzing heart rhythm.
So don't touch them at this point.
Do not touch the patient.
It's analysing now.
Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
All clear, everybody clear. Shock now.
Shock delivered.
Arms and legs would go in the real world.
Start CPR.
Then always do CPR. You do that for 2 minutes. Then after 2 minutes, the defib would do this.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button.
All clear, all clear. Shocking now.
Shock delivered.
And then CPR again, straight away.
Start CPR.
So, if this was a child, so 0 to approximately 7 years old, you do it slightly differently. So you'd arrive at the scene, you'd do all of your normal checks, you'd start CPR, send to your defib, as before, and as soon as the defib arrives, switch the defib on. Except this time, you'll put the pads
Applying pads to patient's bare chest.
in the centre of the chest.
Plug-in pads connector next to flashing light.
Now these pads could actually be different pads, they could be child pads, or in some units you'd use the same pads,
Plug-in connector.
and then there's a little switch.
Not touch the patient.
Analysing heart rhythm now.
Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now.
All clear, shocking now.
Shock delivered.
Arms and legs go up, and then on top of the pad in the middle there,
Start CPR.
away you go. So you do your same, 30 compressions, 2 breaths, continue, continue, continue. Hopefully it'd come back after 1, maybe 2 shocks, but you just continue with 2-minute cycles until the ambulance tells you to stop. When dealing with a baby casualty, so under the age of 1, as you can see, you put 1 pad on the front, on the bare skin, you'd roll them over, put the second pad on the back, on the bare skin, and you'd shock as normal. If needed, you'd do CPR on the top of the pad as shown in the picture.